Well, summer's over, but you still need to be aware of your skin health. We headed to Perisur Dermatology to learn more.
Now, Deborah, you're a dermatology nurse practitioner, and you see all kinds of skin. And skin is something that maybe people aren't taking that great a care of these days.
That is correct. People regularly see their doctor once a year for an annual physical exam. Women get a mammogram annually. You go to the dentist. Since 3/4 of the population has not ever seen a dermatologist, we highly encourage an annual skin exam as well.
And so when we're talking about a skin exam, you do this, it's head to toe. And what are you looking for?
Yes, ma'am. So we do examine the patient from head to toe, areas that you wouldn't even think, in the mouth, bottom of the feet, toenails, fingernails. And what we're looking for is any precancerous or cancerous lesion, mainly melanoma, but there's many skin cancers that are non-melanoma. The melanomas can be hidden. People think that they're a black dot, but they can present in many different ways. So we look for cancers that the average person would not even think was a skin cancer.
Right, and the full body scan, it sounds like a big deal, but really it's not.
No, it's not a big deal. We're very thorough, but it doesn't take too long. We check the scalp, we check inside the mouth, the entire cutaneous surface. We look for anything, and if we find anything that we're suspicious may be the beginning of a cancer or even a cancer, we do biopsies. The biopsies are short and quick, and then if they do prove to be something concerning, we have an on-site Mohs surgeon who will take care of the lesion in a cosmetically pleasing way. And if not, we send you to a surgeon.
Is this something you recommend for people who spend more time in the sun, or do you recommend that children start doing this? Who needs to have this done?
Okay. We believe everybody needs a skin exam at least annually, more frequently if they've had a past medical history. Teenagers all the way up to the elderly. As you increase in age, your risk for skin cancer increases. People with blonde hair, blue eyes, fair complexion, history of blistering burns and intense sun exposure are at higher risk for skin cancer. But generally, everyone needs a skin exam more frequently as you age and with a history of skin cancer.
Right, and we know that it can be genetic, but...
Yes, well, there is a genetic component, but no, definitely not all the time. The increase of melanoma and other skin cancers has definitely increased with tanning bed use. And also, people are more vigilant with sun protection now, but years ago they were not. So if it's a precancerous lesion, sometimes just a topical can take care of the area. We will always reevaluate to make sure the lesion has cleared. If it's progressed, they may need liquid nitrogen. Some people will need a procedure called EDNC. But again, some people will need to see our Mohs surgeon.
And it's probably just a good idea to, even if you see something that you're not sure what it is, to get it checked out by the professionals.
We are trained to recognize all skin cancers, especially melanomas, and it is a very good idea. People will present with what they think is a pimple, which could be a skin cancer. Others will present with what they think is just a rash. So dry scaly patch is oftentimes actually a skin cancer, and if left untreated, they can progress. Melanomas can be fatal.
All right, so come on in and get a total body scan.
All right, if you want to visit the folks over at Dr. David Perisur Dermatology Specialist, they have 7 locations across Hampton Roads. You can give them a call at 622-6315. Also online, they're at perisurdermatology.info.